how do I coach on the question of tube feeding? I think it's very family and patient specific, depending on what the goals are that they want to achieve. We also have evidence now in medicine about who benefits from those types of interventions and who doesn't. And so I think when I talk to families, I say, what do you want to get out of IV fluids, or putting in a feeding tube, or a nasogastric tube, or starting a major IV so that they can have nutrition through the vein? What do they want to get out of it? Is it so that their loved one will live longer? Is it so that their loved one won't suffer? Because there is often a misconception that somebody will starve when they're dying, and actually the dying process is a beautiful one. Our body changes and we don't have a sensation of wanting to eat or drink, and our body shuts down and toxins build up. So we actually don't starve. Our body just slows down and we die. But I think with the medicalization of these types of interventions, a lot of people have questions about them and want to know, is it going to help my loved one or not? So we have evidence that if you have end-stage dementia, meaning that you're bedbound and requiring careful hand feeding to eat, that putting a feeding tube in is not going to prolong your life or give you quality of life. It's not going to prevent wounds. It's not going to prevent aspiration pneumonias. So I can talk to patients' families about that being more of a burden to put a feeding tube in somebody with end-stage dementia than a benefit. So some of the burdens, if somebody's in the terminal stages of their disease process, some of the burdens of intravenous fluids or tube feeding are that they may not use what we're giving their body properly. And so they could have swelling in their extremities and their legs and arms. They could have increased oral secretions that are difficult for them to manage. If it's a feeding tube, they could have more heartburn and reflux and aspiration pneumonias. And then also, when somebody's hooked up to a pole like that, they're less likely to be out of their bed and out of their room and social. And so that's one of the other issues with using those types of interventions. They're more likely to be in their bed and less likely to be out of their room.